Hi, it's Dr. Darty back with Chapter 12, the endocrine system. Another vast and complex system that your book, bless its heart, has tried to distill into just a few pages for us. So we'll see what they've done. They've made good selections, as usual, about some of the most important terms. Let's start with the word endocrine. Endocrine refers to a gland that releases its product directly into a bodily fluid, usually the blood, without needing a duct. Now, you remember back in the GI chapter, the digestive chapter, we talked about how the pancreas was in part an exocrine gland, a gland that releases its product onto a body surface or cavity through a duct or tube. You have sweat glands all over your body that do the same thing, oil glands. All of those glands, your salivary glands, have a duct or tube that releases their product onto a body surface or cavity. So they're called exocrine. But today we're talking about endocrine glands. Glands that in a system, each of them releases a hormone, a long-distance chemical messenger, into the body fluids, typically almost always the blood. So you know more about these than you probably realize, but we'll go over a few just to keep ourselves straight. So part of your brain, believe it or not, is actually an endocrine gland, and a very important part at that, and that is the hypothalamus. It's part of the diencephalon of your brain. That's a big word. But the hypothalamus is part of your nervous system, but it also makes a number of hormones like antidiuretic hormone, ADH, that helps regulate the the water balance in your body. Several hormones are actually created there. So your hypothalamus is in close contact. It's kind of a bridge, if you will, between your nervous system and your endocrine system. Right below it sits the pituitary gland, sometimes referred to as your body's master gland. It's about the size of a pea, and it sits in its own little special spot called the sella turcica, deep in the base of your brain, in the bony base of your brain. So your pituitary gland directs the activities of several other endocrine glands, and also has a couple of hormones that are directly active on the body release from it. If you take A&P, they'll make a big deal about the difference between the anterior pituitary gland and the posterior pituitary gland, how they originate, what they secrete. We're not going to get that fancy today. But you should be aware that the pituitary gland plays an important part in stimulating or turning off some of the other endocrine glands. It's really fascinating, but it's a bit much if you haven't already studied that. So they start right off on page 327 telling you about some of these hormones. So melatonin, it's sort of fashionable right now because you can buy it at GNC or the drugstore because it's considered a nutritional supplement that helps people sleep or helps with jet lag. You can read up for yourself, maybe not. But melatonin is a hormone. Oxytocin is another one. Oxytocin is responsible for causing lactation, for milk to let down on a nursing mother. But oxytocin also plays an important role in human emotions. Oxytocin is sometimes called the cuddle hormone. It's responsible for that aw feeling when you see something cute, or that sort of bonding feeling you might have toward a cute little animal or to your beloved. That's oxytocin talking when you hear that, have that feeling. The pineal gland, or some people in your book seems to like pineal, so you hear it pronounced both ways, is a tiny little gland that makes melatonin. Prostaglandins are hormones that are found in a variety of cells throughout your body, including in the digestive tract. Prostaglandins play an important role in pain, so a lot of drugs that help to alleviate pain interact with the prostaglandin system. Serotonin, as we said, is a neurotransmitter, but is also considered a hormone, and it's thought to be out of balance in people who have depression. Okay, flipping on over, one of the other important hormones made by your pituitary gland is growth hormone. It's been in the news a lot lately because there's been some information about growth hormone doping in athletes. But growth hormone, before you are fully grown as a little one, it stimulates the growth of bones and muscles, an increase in body mass. That's exactly what you'd expect it to do. Its role is less certain once you are fully grown, although we know that as you age it tends to decline, and some people think that's partly responsible for the loss of muscle mass and the increase in relative amount of fat in older people. Some studies say maybe it's more inactivity, poor diet, etc. At any rate, there have been some famous cases of athletes being caught using growth hormone to try and enhance their amount of muscle, their strength. As a medical problem, we see a couple of different issues with growth hormone. Clearly, if a little child's pituitary doesn't make growth hormone, that child is not going to grow normally, and they call that pituitary dwarfism, growth failure, short stature. These children often have what's described as a cherubic appearance. They appear younger than they are. So you might see a 14-year-old who's still being handed a child's menu when he or she goes into a restaurant because they look so much younger. They're smaller and they just look younger. Growth hormone now can be supplemented. So once that problem is recognized by a pediatrician or a general practitioner, family practitioner who is following the child's growth chart, referral made to an endocrinologist, someone who studies these hormones, then that can be corrected. Now, on the other end of the spectrum, we can see people who make too much growth hormone. If that happens before puberty, when your bones are still able to increase in length, then you may end up with a person who is remarkably tall. And that might sound like a good thing if you want a career in the NBA, but it also causes a lot of problems because they have too much soft tissue as well. So they often, in days before we knew how to treat this, had difficulty with their extremities, their hands and their feet, and typically have other internal problems that lead to a shorter than expected lifespan. So too much growth hormone before puberty leads to gigantism, being a giant. Now, what happens if you develop a tumor that secretes growth hormone after you finish growing? Since things can't grow up, they only grow out. So you may see thickening of the voice box leading to a lower voice. Ring size goes up, hat size goes up, facial features become more coarse, the tongue enlarges, a lot of internal problems as well from an excess of growth hormone. So you can have too much of a good thing. Then your book goes on to mention, let's go on down to diabetes insipidus. This has nothing to do with diabetes mellitus or sugar diabetes. Diabetes insipidus happens when you don't make enough anti-diuretic hormone, so you urinate out water that you should be holding on to. So lots of urine volume leading to dehydration and thirst. You can also throw your sodium balance way out of whack, and that can cause problems with nervous functioning. It can happen for a lot of reasons, but a common reason, other than pituitary tumors, is head trauma can lead to diabetes insipidus. On the other hand, if you secrete too much antidiuretic hormone, then your body holds on to fluid that it shouldn't. Your sodium level drops relative to the concentration of sodium, and you can have seizures and all sorts of problems. That occurs with some tumors and can also occur after a head injury. Let's go on. Prolactin. Prolactin is released by the anterior pituitary, and it causes a nursing mom to make milk. Prolactin does. Milk production. For the milk to let down, as we said, that requires oxytocin. So two hormones are required for successful nursing. Prolactin to make milk and oxytocin to let milk down. Then they talk about they don't mention it by name, which is interesting. Not on this page anyway. ACTH, adrenocorticotropic hormone. That is a pituitary hormone that tells your adrenal glands to step it up. And we'll talk about that later. And then there's thyrotropin, or TSH, which is thyroid stimulating hormone. Your brain tells your thyroid to step it up. You can see how these are interconnected in some pretty complex ways. Moving on, they talk about ways that you approach some of the pituitary tumors that cause this. They can either go through your skull, or they can go up through the sphenoid bone in the roof of your nose. And they talk about that. Moving on to some things you will see more commonly. The thyroid gland. The thyroid gland is the main metabolic gland in your body. It has to do with the rate at which your body converts food into energy. In old-fashioned cars, your thyroid gland would be analogous to a carburetor. I guess now it would be your fuel injection system. But it regulates how your body burns fuel. Overly simplistic, but it works for us. So, if your body is burning fuel too quickly, you would feel warm. So people who have overactive thyroid glands are often warmer than other people in the same room. It causes tremors or jitteriness, a rapid heart rate. Some kinds of overactive thyroid glands cause a bulging forward of the eyes because it stimulates the fat on the back of the orbit that cushions your eye, and it causes what we call exophthalmos, bulging eyes. There's a commercial on TV right now for a new drug that treats that problem. The late President Bush and his wife Barbara both had Graves' disease, which is an overactive thyroid gland that often results, and it seemed to affect Barbara more than it did George, but you may have followed that along. Now, what about an underactive thyroid gland? Well, an underactive thyroid gland, which is actually the more common problem, often occurs with aging. Then you're not burning fuel fast enough. So these people tend to feel cold. They may gain weight, where a hyperactive thyroid causes you to lose weight. So if your thyroid is sluggish, you may gain weight. You might feel tired instead of jittery and anxious. Constipation often goes along with it. So hypothyroidism is very, very common. And once it's recognized and diagnosed, it can be treated with thyroid supplementation orally. Your thymus gland is most active in very young children. The thymus gland tends to involute or shrink as we age. In old people, you'd be pressed to find a thymus gland. It's in the mediastinum, the area between the lungs, and it plays an important role in the development of immunity. So it makes sense that your thymus gland would be very active in young children who are developing their own immune system. The T cells we mentioned back in the chapter on blood, they're so named because they mature in the thymus, T cells. Let's see. Thyroid hormone comes in two main varieties, triiodothyronine and thyroxine, but on lab slips you will usually see it designated as T3 and T4. When we want to check somebody's thyroid gland, we usually check their T3, their T4, and their TSH, or thyroid stimulating hormone, as a way of trying to determine what's going on if things aren't right. Bigger discussion of that is beyond our scope, but it is very interesting. Now, in the back of the thyroid gland, which is situated here in your neck, there are some tiny button-like glands that are distinct from the thyroid tissue, and they are called parathyroid glands. They have a completely different job. Their job is to regulate the amount of calcium in your blood. You remember we said back in the bone chapter that an often overlooked job of your skeleton is to be like a bank for calcium. Your body has to keep calcium in a very narrow range for your muscles and your heart and your nerves to work. So the parathyroid glands are in charge of making parathyroid hormone, PTH, which elevates blood calcium. It has several ways of doing this. It can take it right out of the bone. It can tell your digestive tract to absorb more calcium. It's got a couple of other tricks too. It tells your kidneys not to let any go out in your urine. Hang on to that stuff. We need it. So overall, the role of the parathyroid gland is to increase your calcium in your bloodstream. Moving on. Oh, look at all these different things they have. Here is something I would point out to you that I'm sort of horrified by, and we'll also talk to the publisher of your book. Oh, and there's a nice picture on page 336 of Exophthalmos. There is a picture of a woman who has a big goiter from an underactive thyroid. It's quite a disturbing picture. And there's an infant with what they describe as cretinism. Don't use that term. We don't use it anymore. It's insulting. The term for a child who is born without an active thyroid gland is neonatal hypothyroidism. We don't call them cretins anymore. Thyroid hormone in infants is absolutely essential for brain development. So if any of you have brought a newborn home from the hospital, you know they do that little heel stick before they let you go, or if you went home early, they have you come back and have the heel stick. We're checking for several diseases, but the one that's most commonly found is hypothyroidism. So we want to know right away if a baby's thyroid gland is not working, because we want that little one's brain to develop normally. We don't want them to suffer the permanent mental disability that can result from not having an active thyroid gland. All right, moving on. There's so much in this one. Let's talk a little bit about the adrenal glands. Your adrenal glands sit on top of your kidneys. That's how they got their name. They look like little dunce caps sitting right on top of your kidney. And they have a couple of different functions. The outer part of an adrenal gland, called the adrenal cortex, makes corticosteroids. Do you see where it gets the name from? Cortex, corticosteroids. And corticosteroids include cortisone, cortisol, a bunch of different ones. And they have profound effects on your body. Their overall effect is to prepare you for fight or flight. So if you are being chased by a tiger, couple of things need to happen. One is you want your blood sugar to go up. You want your muscles to have plenty of access to fuel so that they can get you away from the tiger. So one effect of corticosteroids is to raise blood sugar. And that's an important effect. They also raise blood pressure. And it's a complex mechanism, but it involves telling your body to hang on to salt and water so that your blood pressure goes up. Because again, you want your muscles to have access to plenty of blood flow as you run from the tiger or deal with the stress. Now, in situations of chronic stress, because in today's world we don't often find ourselves running from tigers, but we might have to go to work every day where we have a boss who drives us crazy, or a very stressful job, think air traffic control or whatever stressful job you might have encountered. So what's intended to be by nature a very occasional sort of emergency process can become a chronic process where you're all the time dealing with raised blood sugar and raised blood pressure, and that's not good. Your body can also mess up and just make too much all the time, and that's called Cushing syndrome. It causes weight gain, causes breakdown in your connective tissue, especially in your skin and your joints, all manner of problems, and again, beyond our scope here. Now, the inner part of your adrenal gland, called the medulla, makes aldosterone. I'm sorry, that's wrong. It's also made in the cortex. I apologize. The cortex also makes aldosterone. Aldosterone is the main determinant of sodium balance in your body. Now again, hang with me here. If you've had any biochem or A&P, you know that water always follows salt. So if your body is being told, mainly in your kidneys, to hang on to salt, that means you also hang on to water, and it helps to regulate your blood pressure by regulating the amount of fluid in your blood vessels. However, if you don't make enough of that hormone, then you don't have enough salt and water in your bloodstream, and it can cause really collapse if it's bad enough. There's a picture on page 340 of President John F. Kennedy. No one knew it at the time he was president. It was a closely guarded secret, but he suffered from a lack of aldosterone. And that, they have the picture of it there, is called Addison disease, and it discusses it there on page 340. Now, back to what I should have said. The medulla, or inner part of the adrenal gland, makes catecholamines, epinephrine and norepinephrine, those fight or flight hormones that are also neurotransmitters and that activate the sympathetic part of your nervous system, as we discussed back in the nervous system chapter. There's a lot going on here. Also, the endocrine system involves hormones from your pituitary that depending on if you have testes or ovaries, controls sex drive and the production of sex hormones. So in males, this controls the ability of the testis to produce androgen. More on that when we get to male reproductive. And in females, it controls the action of the ovaries to make estrogen, progestin. More about that later. Now the pancreas, the endocrine part of the pancreas. We already said that the exocrine pancreas makes most of the enzymes responsible for digesting your food in the small intestine. But there are these little islands of tissue, now called the pancreatic islets. Used to be called the islets of Langerhans, but we're trying to get rid of everybody's names on anatomical structures. So now they're called the pancreatic islets, that contain the cells that make insulin. Insulin lowers your blood sugar by allowing that sugar to go into your cells. So insulin causes sugar to leave your bloodstream and go into your cells where it can be used for energy. The islets also make a hormone called glucagon that we don't talk about as much that can raise your blood sugar. And it does that in a couple of different ways, primarily by telling your liver to take some of the glycogen stored there, where glucose is stored in chains, and break it apart into glucose. So the pancreatic islets control the level of blood sugar in your body. Now you can see if those were completely destroyed, what would happen is that sugar could not get out of your bloodstream into your cells. So your blood sugar would be very high, but your cells would not be getting the sugar, so you'd be tired, you'd lose weight, the sugar would be spilling out in your urine, taking water with it, and that's what type 1 or insulin-dependent diabetes is. On the other hand, from a bunch of complex mechanisms, you can be making insulin, but if you will, the locks on your cells that insulin should open like a key, pretend somebody has super glued all those. So even though you are making insulin, it can't activate the doors on the cells that should let the sugar in appropriately. That can sometimes be controlled by diet, exercise, lifestyle changes, and that's called type 2 diabetes. Now, it can become insulin dependent if it progresses far enough, but it's a different problem altogether. Type 1 diabetics will always require supplementation with insulin, where type 2 diabetics may be able to use oral medications, although there are a lot of injectables. You see the commercials too. Lifestyle diet, a more complex situation. Oh, what else? What else can we talk about in the endocrine system? I think we'll probably actually stop there. There's some good information in your book, but that's kind of an overwhelming amount, and I think we'll stop for today. If you have questions, let me know. The PowerPoint addresses some of the things we didn't have time for here. Thank you.